Hi, my name is Dr. Jesse Schulz. I'm going to be talking to you today about the 11th cranial nerve, or the spinal accessory nerve, and the two muscles it innervates. The upper trapezius, right here in the upper shoulder, and number two, the muscle right here on the front part of the outside of my neck, the sternocleidomastoid muscle. It's kind of a long word to say, so we're just going to call it the SCM. These two muscles, for people that have neck problems and neck pain, can be fairly significant. There's a trigger point here in the middle portion of the upper trapezius that can give you kind of a spreading sort of pain anywhere from the side of the neck near the base of the skull to the shoulder. A lot of people that have shoulder injuries, because of the muscles in the shoulder not working so well, they'll use their shoulder muscle to kind of compensate the upper trapezius, and they'll get a trigger point there, and it'll have to be worked out in order to do the recovery and the rehab for their actual shoulder problem. But many times, if you've got an issue in your neck, those muscles will tend to kind of tighten up as well. And the upper trapezius muscle here in the shoulder again, if you have a problem with your C3 or 4 nerve roots in your neck, the third or fourth cervical nerve roots, that also goes to that muscle, and that can also cause some problems there. These muscles respond okay to massage. The upper trapezius responds much better to massage than the sternocleidomastoid muscle, or the SCM. Joint manipulations of the neck, the upper back, I think work fairly well for these two muscles, but I think it requires more manipulations than I would normally like to do. So I find that flossing and tensioning of the spinal accessory nerve seems to be a pretty good treatment for most people that have problems with these muscles. And the flossing itself, while it's supposed to get the nerve moving better from where it comes out of the neck and head and goes to these two muscles, there's so much neck and shoulder girdle motion that's being used with it. It might also just be loosening up the joints and loosening up the muscles by just moving your body around. But either way, this seems to be a very effective technique for people that have, again, tightness or pain here in the SCM or back here in the upper trapezius. So I hope you enjoy this video, and I hope you learned something. I would encourage you to consult with a physician or a physical therapist to make sure that this is a safe sort of treatment for you to do for yourself, because there is so much neck motion during this. If you've recently had neck surgery, or if you have a bulging disc in your neck, this may be something that is not right for you to do. Thank you. So we're going to start off with flossing, basically the nerves in the spinal cord. We're going to be using movements of the neck, the head, the upper back or the thoracic spine, and the lower back and pelvis to basically get the whole spinal cord moving a little bit better. This tends to be, I think, a very good warm-up for the neural system before doing any flossing for the arms or for the legs. So how we're going to start with this is on our hands and knees. If you have any pain in your knees with kneeling, I encourage you to try a pillow underneath your knees. That won't take away from the effectiveness of the exercise. If you still are unable to kneel, there are modifications for this, and if you do have a physical therapist that you're working with currently, they'll be able to show you how to modify this. But what we're going to start off with is basically motions of the pelvis at the bottom end of the spinal cord. What we're going to do is let our lower back sag down towards the floor. It's almost like you're sticking out your butt. You're going to hold that for about 2 seconds, and then we're going to basically curl our tailbone underneath us by rounding our lower back up towards the ceiling. And we're going to do this 15 times, holding for 2 seconds at the end of each motion. So sticking our butt out, holding for 2 seconds, arching the back or letting it sag, and then going the other direction. And again, with every motion that we're doing for this, I encourage you to only move as far as you can comfortably, but do move through the largest arc of motion that you can comfortably. After we do 15 each of those motions, sticking the butt out and curling the tailbone underneath us, what we're going to do is raise our back up towards the ceiling, our upper back, like you're kind of rounding your upper back, and then letting it sag down. Holding for 2 seconds again in each position. I encourage you strongly to try to keep your elbows straight if that's comfortable for you. Many times I find that people are bending their elbows and straightening their elbows. They think they're moving their upper back, but they are not actually doing that. So if you keep your elbows locked straight, if it's comfortable for you, it's more of a guarantee that you're doing the right motion with your upper back. After we do 15 of those motions with rounding our back up and letting our upper back sag down, we're going to now incorporate the neck motion. So when I round my back up towards the ceiling, I'm going to bring my chin towards my chest. I will hold that for 2 seconds and let my upper back sag down while I look up as far as I comfortably can with my neck. Hold for 2 seconds and reverse. And I will again do that motion for 15 times. Sometimes you only need to do these motions 10 times or less, but again, if this is the first time that you're doing this, I encourage you to do about 15. That way you know for sure if it's going to work or not for you. I find for most people it works out best at first to just go over the neck motions because they're kind of odd. We're going to be doing a combination of 2 different motions. One, side bending or tilting of the neck from side to side, which is fairly basic. Going one direction and the other direction. Again, for you, only as far as you can comfortably go without pain. And then the other motion that we'll be combining this tilting with is going to be protraction and retraction. Protraction is sticking your head forward, like a turtle coming out of your shell. Retraction is the opposite. Trying to give yourself a double chin or just pulling your head back. I would encourage you when you're doing this to try to avoid doing excessive extension or flexion of the neck. It's not going to really adversely affect anything, but it's not helpful, and if you do have any problems in your neck, it may be able to aggravate it a little bit. So what we're going to be doing first is a combination of those two. So we're going to be treating my right shoulder. So when we're doing this, I'm going to tilt my head away from my right shoulder, and I'm going to be retracting or giving myself a double chin, and then I'm going to tilt towards my right shoulder and stick my head forward. So I'm just going to go through this motion 2 or 3 more times. I would encourage you to do it as many times as it takes for you to feel comfortable with this, because if you start getting screwed up with the neck motion, when we start incorporating the shoulder motion along with it, you're just going to get off track, and you might be doing tensioning when you intend to be doing flossing. So again, I'm going to tilt away from my right shoulder with retraction. And it doesn't matter if you do both at the same time or if you do one and then the other. And then I'm going to protract and side bend towards my shoulder. Again, retract and side bend away. Side bend towards with protraction. And you can see when I go to my left, I tend to kind of rotate my head a little bit. Try to avoid rotation as I also retract. And then this way. And of course, if you're doing this for your left shoulder, it would be exactly the same. You're going to side bend toward it with protraction and side bend away with retraction. So that's a basic neck motion for this. Now, the second step is a shoulder motion, which by itself tends to be a lot easier. You're going to be bringing your shoulders forward, like you're rounding your shoulders, and then pulling your shoulders back, retracting your shoulders. So we're going to protract, round, retract, pull back, protract, and retract. And those are the basic motions of this technique. The next part of the video I'm going to show you is going to be the flossing for the spinal accessory nerve. We're going to be starting with flossing for the spinal accessory nerve, and it's going to be a combination of those 2 motions I just showed you. So for my right shoulder, we're going to pull our shoulders forward or protract, tilt our head away, and we're going to retract, tuck our chin in. Then we're going to bring our shoulders back into retraction, tilt towards the shoulder, the right shoulder, the problematic one, with protraction. Stick our shoulders forward, tilt our head away with our chin tucked in. Again, pull the shoulders back, tilt our head towards the side that's the problematic side with our chin forward or protracted. And we're only going to move as far as you comfortably can for that. You're going to repeat 10 to 15 times. And then you're going to start with the tensioning if it's comfortable for you, which is the next step. For tensioning of the spinal accessory nerve, again, we'll pretend my right shoulder needs a spinal accessory nerve treated. We're going to pull our shoulders back or retract, tilt our head away, and tuck our chin in, hold for 2 seconds, and then relax back to the middle. Retract the shoulders, tilt our head away, tuck the chin in, hold for 2 seconds, relax back to the middle. And then repeat 10 to 15 times.